Everybody, we're back with TJ's Tuesday Tidbits with Carpal Tunnel Syndrome, alright? Now by the time we're done with this 5-minute little video, you guys are going to be carpal tunnel specialists. Hence, we're wearing the wrist brace, okay? This is your common carpal tunnel wrist brace. It has a little bar in here that comes up into here, has some straps which can tighten up nice, goes right around the wrist. This is a universal one, goes on your right hand or left hand, okay? That's what I would suggest getting if you have any type of carpal tunnel type of syndrome. So what happens with carpal tunnel? You have a nerve, it's called your median nerve, okay? And it runs inside your carpal tunnel area of your wrist. Now, that's right through here, okay? Your median nerve runs up and it innervates these 3 fingers, okay? And 1/2 of this finger. So you got these median, or the very tips of your finger especially, and then the end of these fingers. There's also a branch that comes up into your palm area, okay? So if you're getting numbness into these 3 fingers, or the tips of all 5, you have a median nerve compression possibly, okay, and that could be from carpal tunnel. Now there's lots of different areas that can also be compressed that mimic this. You have a thoracic outlet syndrome, which comes more up into the shoulder. You can have pronator teres impingement, ligament of Struthers, you can have supinator impingement, you can have ulnar groove impingement, you can go into the back side of the hand and you start getting bicipital groove impingements, quadrangular space impingements. All these occur down the arm and can cause numbness. How do you know which one is happening and why? You go to a specialist, or you go to a functional neurologist who's trained in understanding how these nerves function. If you have numbness in these 2 fingers, that is not a carpal tunnel syndrome. Okay, that's going to be an ulnar nerve impingement, which can come also through the wrist. Okay, you can get impingement at the area of Froge or your Guillain tunnel. Okay, so this is why it's very important to understand exactly what's going on and why. Okay, now with carpal tunnel, and a lot of docs don't know this, or they maybe know it but they don't pay attention to it. If you're having numbness in all 5 fingers and you're having direct numbness in your palm, that doesn't mean that you have carpal tunnel. Okay, you could be having impingement further up the arm. There's a branch that comes out of your median nerve called your palmaris branch, which exits out before the carpal tunnel and innervates your palm. Okay, this is very important for diagnostics, because if you're going to have carpal tunnel surgery and a lot of the numbness is in the palm, that's not going to fix it. You got to go farther up. Okay, there's a lot of mistakes that occur with that. So make sure you know exactly what your symptoms are, where the numbness is, and the specialist knows for sure that that's what's going on. Well, how do they know for sure? Well, they can do x-rays, MRIs, nerve conduction studies are very important for this, okay? Nerve conduction studies can show exactly the health of the nerves and if there's impingement in there, and then they can diagnose where that impingement is. That's why nerve conduction studies are so great for these types of things. What can you do at home? Well, simple. You grab one of these braces, okay? And I'll tell you what I tell my patients every time they come in right off the bat. You grab one of these braces, okay? And you slip it on. You make it tight enough to where there's pressure, but you don't want your hand to go numb, okay? And you wear this every single night for the next 6 weeks. See if that helps, okay? And if that helps, but we're not quite there yet, you can wear it during the day, especially if you have a computer job, okay? Wear that during the day, see if that helps. If that takes care of it, great. Now, most of the time when my patients come in, we're doing this, we're also doing some adjusting and some muscle work with it. Helps out beautifully, okay? Sometimes there's so much damage that surgery is needed, which is okay. If you need surgery, you need surgery, but you need to make sure you understand exactly what's going on before you have any type of procedures. Acupuncture can be beautiful for this. Stimulate these nerves in here, calm down the inflammation, wake up the tissue, and get some beautiful results with some acupuncture. Dietary inflammatives. Reducing the inflammation can help this out drastically, okay? No gluten, no soy, no dairy. Icing this, okay? Try and get the inflammatogens to calm down and knock the inflammation out of there can really reduce the amount of carpal tunnel issues that you have, okay? So what do you do when you come into my office? Well, we check. We figure out where the impingement is going to be at with some examination procedures, and then we start working on those areas. You can have a fall on an outstretched hand, and the radius and ulna in here separate, and then you don't have as much room in the carpal areas, and we need to rehab that. And these braces do a wonderful job for that. So, come to our office, we're going to do muscle work, we're going to do electric stim, we're going to do adjustments, we're going to do laser therapy, we're going to really work on trying to facilitate those nerves and wake them up. At home, B vitamins can be very good for rehabilitating these nerves. Make sure that the proper B vitamins, make sure you might need methyl B vitamins, and then wearing these braces. Icing if you need to, okay? Stretching these hands different ways are going to be very beneficial. You can look up carpal tunnel stretches online, all right? If you have any issues with carpal tunnel and they're not coming around, or you have more questions, you want further investigation, please call us. We will help you out any way that we can. We help this stuff out all the time. You can find us at foldedfamilychiro.com, send us an email, give us a call, 507-425-0025. Dr. Sarah Gravers over in Edgerton Family Chiropractic, 507-631-7565. Give her a call. She does wonderful myofascial release work for this, okay? And we have Denetter acupuncturists who can work wonders for this too. Give us a call. We'll help you out as much as we can. Next week, guys, we're going to be talking about, we're back on the tennis elbow thing. We're back on tennis elbow with the tendonitis thing, okay? So we'll be covering tennis elbow and a little bit of golfer's elbow, all right? We'll see you guys next week. Thanks.